Tonight, experts call contact tracing critical to stopping the spread of any dangerous disease. Governor DeSantis says they've been doing it since the beginning of our state's COVID crisis. Well, tonight, 4 in Your Corner's Katie LaGrone finds out why, as we look to rebound from the pandemic, that state efforts are falling short and what the plan is moving forward.
May 6th, Miami.
Testing also goes hand in hand with what we call contact tracing. Contact tracing means identifying individuals who have COVID-19, identifying who their contacts are, and having those individuals isolate.
Florida's top doctor went on to declare,
"This is a way that we can actually stop the cycle of transmission from person to person."
Long considered one of the oldest tools in the public health toolbox, contact tracing is a centuries-old way of stopping the spread of dangerous diseases. In Florida, state health leaders have touted the practice as part of the state's day one strategy in its battle against COVID-19.
We've been doing this from the very beginning and are continuing to expand.
But details on how and how much success it's had tracing the virus from person to person remains largely unknown.
It can't look just like we've always done it.
ADRIANE CASALOTTI of the National Association of County and City Health Officials explains why tracing the coronavirus is presenting challenges they've never seen before.
With coronavirus, every minute counts. So every minute that we're not in touch with someone who may be infected and asking them to remove themselves from the general population is a minute that they can be transmitting the disease.
In Florida, after repeated requests for details on its contact tracing efforts, including the number of people traced and the number of those tracing, a spokesperson with the Department of Health told us in this email, more than 1,100 individuals, including students, epidemiologists, and other staff from across the department, are currently involved in contact tracing every positive case of COVID-19 in Florida. That's 1,100 tracers in a state with 21.5 million people.
Is that enough?
Well, we estimate that we need at minimum 30 contact tracers per 100,000 people.
Which means, according to industry standards, Florida is more than 5,000 tracers short. The state says it is successfully meeting the current operational demand, adding the rate of positive cases in Florida is on the decline. But State Senator Janet Cruz, a Democrat from Tampa, remains concerned.
We had to scurry to go hire epidemiologists because we didn't have as many employed as we should have, and we still don't.
And one county health department tells us tracing is entered into a state database for monitoring, which is done through a phone call or text message system. Katie LaGrone, Fox 4 in your corner.